call is 637-0094.
Like, let's say that, Alice Tyron or Rebecca Respicio brought you towels at the middle of the night and it really smelled like fabric softener and you want to share that with us, let us know. Let's keep it on the phones here. It's about to get a little hectic. We're going to bring on businessman Mike Israel. I just saw that he's been kind of been busy in the comments there, Mike.
Yeah, I mean, this is the topic I wanted to talk about today was, the combination quarantine hotels. What are we doing? And what we see now is a vision of what Guam tourism would be like if public health ran everything. And it's unbelievable. I mean, we would literally be back in the ancient days, as everybody wants to go back to. Now we're reduced to begging. This is what our culture is. We beg from the federal government. Oh, please, federal government. At the same time, we're telling them, oh, what you're a colonist? I mean, I'm all confused. So watching this business about how the government thinks they know how to run a hotel business, part of the confusion is that the public health of Guam, they're frozen in time. They literally have no idea what they're doing. So 8, 9, 10 weeks ago when we were confronted by this scare where we were brought by these experts who the governor still keeps listening to, that we're going to have 22,000 deaths on Guam, then later revised down to 1,700 deaths. So in panic, they went out and set up an emergency quarantine down at the airport. I get it. But that was 8, 9, 10 weeks ago. And 8, 9, 10 weeks ago, we didn't have any tests. Now we have a test, so I don't get it. And furthermore, from day one, they always said, oh, by the way, if you ever get test negative, you can escape the quarantine hotel. But the secret was they never designated what test they're going to accept. It was always this vague, well, no, we want the absolute best test, but we don't know what the best test is. They keep specifying things that don't exist.
Yeah, it's like I said, they accept the test that you don't have.
Yeah. Now, I mean, and we can go into all the horror stories, and it is horror stories. I mean, it's not so bad being a 14-day quarantine in your own home, but being forced to put a 14-day quarantine in a hotel run by the government, because that's what it is, it's a hotel being run by the government. That's a nightmare. That's a prison sentence. That's boot camp, as they said. Right. I mean, you will have dinner at 6. What is this, prison? And these are our own people we're doing this to.
Yeah.
Mm-hmm. And frustrations on the outside. Now, I've noticed, and I like the conversation where they were talking about, well, in Guam, we seem to have now split into two. There are two worlds here. One world of those who are being paid and have no fear about their future paychecks. In some cases are being hopefully paid double, they think, or receive 15, 20% wage increases overnight. All for an emergency that doesn't seem to affect anybody. I mean, it really is. I mean, we're sitting around wearing masks that really are not effectual for anything. I mean, the new test coming out. I mean, it was a good idea in the beginning out of a cautious. See, the problem is they start with a rule, and they never want to repeal it. And this is the problem. There's no accountability. Now, how do we create accountability in the government? Follow the Benjamins. Very simple. I guarantee you, if every elected official, every unclassified employee, and every judge on this island stopped receiving paychecks on the day that they ordered all us businesses to shut down so we can't pay our employees, I guarantee you this emergency would have been over months ago. What do you think, Chris?
I wanted to ask Mike about because we actually had former Governor Gutierrez name drop you so we never got to follow up. I was just waiting for you to do your spiel so I could ask about that.
No, that's it. I mean, why do we have to have two worlds on here? I mean, Luke keeps saying we're all in this together. No, Governor, we're not. You, your staff, your people, i.e. GovGuam workers and everybody, they're getting paid very handsomely. We're not. And we're the ones eventually who pay you guys. That's the part that's really frustrating. Yeah. But, okay, what about Governor Gutierrez?
Okay,
that was the one move I absolutely applaud. The governor, great. You've put someone now who has experience in crisis, who knows how to get us out of here. I hope she listens to him.
Right. And so when we brought him on, he had said that he was assembling his own panel of advisors on tourism and the economy. And you were one of the names he dropped. He said, yeah, I'm going to get... I forget who else he said, but
Mark Waldiga.
right, and then
Yeah.
he said Mike Israel. But so, are you on that panel? Can you tell us what happened?
Yes. No,
okay.
no, there's we had a meeting, and one thing amazing about Governor Gutierrez is he is such a confident and secure leader that he is not afraid to bring in the people who will have criticisms. He's not afraid. He sits back, he puts us in a group, and kind of watches like a dogfight. Watches go at each other, and from it he distills a good path, and that's a brilliant leader. Unfortunately, that's not seen what we have in our current governor, where she's listening to a very, very tiny echo chamber of people who are being paid 100%. She has no outsiders on her committee. It's always insiders because she doesn't want to hear criticisms. It hurts, but sometimes you need to hear, because one day those criticisms are going to be at your gates. They're going to be knocking down your gates. I don't know if we're out there yet with torches and pitchforks, but you've heard the voices this morning. People are starting to get mad. They were scared at first and they cowered us, but now we're starting to get mad. And for what? We're looking around. Really? Do you really think we've stopped the spread? I don't think so. I mean, I go on the beach, I go in public, everybody's walking around. Those masks we all wear are next to worthless. I mean, you saw I've sent you some reports on that. We're finding more and more information that, for the most part, this so-called dreaded disease affects a very, very tiny percentage of the population. And all we were scared of 8 weeks ago was, are we going to have enough hospital space? We got so much hospital space, we've reopened the hospital back to normal business, because it's been a joke. For 2 months now, they've had like 0 patients.
Hey, so what are you on this panel with the governor?
Yeah, what happened at the meeting?
We discussed it, and the panel he has is much more focused on how do we open safely, and how do we open in such a way to convey a message that we are a safe place to visit.
So how do we do that, Mike?
Well, we have to have realistic ideas. So one of the first ones is to review the current medical information. And what does the current medical say? Asymptomatic people are not spreaders. It's symptomatic people who test positive. They're the spreaders. Symptomatic means you have a fever. When you have a fever, that means your body has engaged with corona. It's now in a fight. Believe it or not, the vast majority of us, we might catch COVID on the outside of us, but it doesn't seem to injure us. It's like, when you lie down next to your dog, I mean, he's breathing out, I'm sure, tons of dog viruses. Not every dog virus is going to get on you. I mean, it might be on you, and I guess if we had a sensitive enough test, we could even detect it. That's why we're having so much massive false positives. False positives means you're tested to have remnants of the COVID in you or on you, but they're dead. They for some reason got in you, and they weren't even killed by your antibody system, because we're also getting people who aren't developing antibodies, even though they've never had, even though they've tested positive and they have no symptoms. So it's really interesting. And so we're chasing our tail. We're chasing on our tail. We've got to start easing off a little bit. Let us have our freedom back, which is which is what we're entitled to. And and that's the big word, if we start having hospitalizations and other real issues, we're chasing ghosts right now, and that's why everybody's scared.
So Mike, in this meeting, was it discussed about lifting the public health emergency declaration, because she extended it? It expires on June 30th, but the target to restart tourism is July 1st. So,
okay. One of the reasons we want to do that is, remember, this is not like tap water. You don't just turn it on, turn it off. Tourism in Guam, you have to travel literally thousands of miles to get here. We have to have people booking reservations. Even though we have symbolically said, "Oh, we're open for business in July," we're not going to have real business until August, September, October. Even then, it's questionable. It will be years before we recover to where we were. And FYI, that means no revenues for the government of Guam. We're going to get used to this new reality. Wait till the longer we hold off. So our July 1 opening is a good first step forward. Then we also requested, and we're.
But do you believe that this public health emergency needs to be lifted by 1 July? I mean, how could we?
If I was the governor of Guam right now, but I'm not, I would just cancel it right now and watch to see what happens. We now have, unlike 2 months, 3 months ago, I don't fault the governor for originally issuing the emergency order, but I do fault her now because we now have hospital capability, so much so we've even we're turning down hospitals. She's purchased another additional hospital beds on top of all that. We have enough hospital beds to cover 350 hospitalizations for COVID. We have zero. We were concerned about our hospitalization capacity 3-4 months ago. We were concerned about treatments. We had no known treatments. Now, hydroxychloroquine, chloroquine, or whatever they call it. I call them Trump pills. It pisses off everybody. But guess what? They work. The world leaders are taking them. You see, even the Democrats, when they have a spouse that has it, guess what? The go-to medication, the go-to one was take some hydroxy, especially if you catch it early.
I'm just going to stick to my disinfectants. They're working pretty good.
Well, or shine a light down your throat. That's supposed to work according to Trump, too,
So, I mean, I guess the point Bree is making is
we have tools now. We don't have to have this draconian system she's put in place where we all walk around thinking we're going to drop dead. Mm-hmm. We haven't had any real deaths. Mm-hmm. The 5, they were at the very beginning. We haven't had any since then because now we have ways to treat it if you happen to get it. But this is a very mild disease. It's just been blown out of proportion with false reporting. They're now they got murder they got murder and murder victims now being listed as COVID deaths.
All right, but just getting back to that public health emergency, because you are part of this group with former Governor Carl Gutierrez, is that part of the plan to have this to convince the governor to lift the public health emergency by June 30th, so that come July 1st, or even if we start marketing Guam now, that we're not saying, oh yeah, come to Guam, but we're still in a public health emergency.
Yeah,
it's safe. Come on in.
Is one of the paradoxes. I mean, when we need to do things incrementally. So first we had to get a message out. In fact, original idea was, why don't we delay announcing it until sometime in June? And we said, no, you don't understand. Right now, airlines are closing their books, i.e., we're going to fly planes here, here, and here. If we don't announce within 24 hours of when we met, and to the governor's credit, she did listen to Carl Gutierrez, Governor Carl, and she did announce, which is a great first step. But we have a lot of things to do in the meantime. That's why we have a whole month to do it. We need to put in place procedures, realistic procedures that people think, oh, you're just going to fly right into Guam unprotected and we're going to contaminate all of Guam. No. First off, we just went ahead and limited it to Taiwan, South Korea, and Japan. Why? Because their numbers of handling the COVID, and they're much further along the way than we are even lower than ours. And even at the peak of the industry, it's like 6% of the population at any one time. Okay? So we don't see tourists as much of a threat. In fact, even the CDC coordinator on Guam, or the person who claims to represent the CDC, has said, yeah, we don't have any cases of a spread from a tourist from those 3 countries to the population. We have them from Manila, and those are residents who went to Manila for treatments, and then they came back sick. Manila is basically our go-to place for the seriously ill. Right. And that's why the 3 other cases that died, they were from Manila. And I have no idea what their conditions were. I do know the first 2, they were in hospice care, basically. They would have died any second now.
Mike, because I just want to ask, as I don't know, are people from Taiwan, Japan, South Korea, are they already traveling around touristing as we speak?
No. Unfortunately, their jurisdictions are what they're doing is they're opening up their economies. That's what you saw the big announcement, why we're excited. Because, again, everything's about a first step. They're opening up their economies, but they still have in place vigorous quarantine requirements. In fact, even Taiwan has said they're not even going to allow people into October. But by us opening up and making a declaration, the airlines are going to say, good, let's position some planes that can at least have a chance of going to Guam, and then we're going to pressure the other governments. If we don't do something, if we don't show some leadership in the Pacific, we're going to stay in perpetual lockdown, and Guam cannot survive. There's not enough federal money in the world to keep Guam afloat. It just doesn't work that way.
So who else is on Governor Gutierrez's superhero club?
Well, David John and Ken Cook, who are part of the inner circle. Remember, there's various circles, and this is why this committee that with Carl is more focused on opening tourism. It's only a part of it, the decision-making process.
Right.
And our recommendation is, as you walk in, as you fly into the airport, you're asked to fill out a card. What is your name? Who are the members of your party? What hotel are you staying at? And what is the contact number, either a cell phone number or an internet? Almost 100% of all tourists now have cell phones that work when they're on Guam. As they walk through the screening process, they're going to hit the airport. We have at the airport, they've now installed through a $20 million FAA grant, they've installed these sensitive thermal imaging centers. And if you walk in and you're under a certain temperature, I mean, I just call it red because I don't know the details, but if you're blue, no problem. You turn red, i.e. you're a little hot, they're going to ask you to step aside. They're going to take an actual test, and the actual test either comes out negative, in which case I guess you're allowed to continue with your pack, or it comes out positive, in which case then you're going to be given a choice. Turn around, fly back to your country of origin, or go into a quarantine until you either clear quarantine or you, not even quarantine anymore, it's called isolation. And this is part of the problem. We're very sloppy with our words. Quarantine means we think you might have COVID, but we don't know. Isolation means we know you have COVID and we want you to stay isolated. See the difference? And this is in the law. The problem is public health doesn't know how to read the law, and they just put everybody into isolation automatically. Quarantine means we have no reason to know whether you are in or out. Right. But now we have a test. And so therefore we don't need quarantine anymore. What we should do is this isolation if we show you're positive for COVID. If not, please go along your way. Why are we disturbing you? Mm-hmm. And remember, the Guam International Airport, even without any controls whatsoever, has backup lines up to 1 to 2 hours. It was in our heyday when we had 4,000 visitors a day visiting Guam.
All right, Mike. Okay,
yeah.
You're kind of losing me here. So who else is on this Uncle Carl Club committee?
And then there was Richard. Not Richard. Let's see. There's Jerry Paris. Right. Very big old hand at.
What do you think of Jerry Paris? Well, first of all, what do you think of Bobby Alvarez? It finally looks like United got their man.
Bobby Alvarez. I'm sorry. I don't live in the political world. I have no idea what a Bobby Alvarez is.
Oh, he was the deputy at GVB, and now he's not.
Okay. GVB unfortunately has turned into a political organization, and I stay away from politics. I like to serve meals and clean beds. I don't get into politics except now because they've cut off our supply of business, and I have 1,000 local families that are looking at it and saying, when are we going to start eating? When are we going to start working again so we can support ourselves instead of having to go beg food along the side of the road from federal dispensaries and stuff. And that's what we're trying to do.
Mike, what's the debate about testing at the airport? Because I heard there was a debate about incoming, right. Incoming travelers. Do we want to test them there, or what's your take on that?
No, because testing should not just be done across the board. It's not. Testing doesn't accomplish anything. The false positives are astronomical. And even if you're negative one moment, you can become positive the next. So testing doesn't mean anything. We need to be a little more strategic about what we do. We need to first screen, and we need to screen to see if you're symptomatic. If you're running a fever, then we test you. Testing asymptomatic people and asymptomatic means there's no reason to believe they have any reason, and testing them wholesale. Remember, we used to have 1 to 2 hour lines. We're going to have like 8 or 10. I mean, these tests might take 8 hours. I mean, I don't know what kind of tests the public health is using. I don't think they know. I think it's all random because there's not been one test approved. Because I wanted to bring not visitors, but my family back. And they said, how do we get to Guam? I said, well, they said if you took a 72-hour test, you could fly right in and walk through. The problem is that the person just said, yeah, but they didn't specify what test you have to have. They don't specify what person has to sign off on it. What type of doctor? A doctor in Guam only is the only one. Again, they set up a rule back 8, 9, 10 weeks ago, and they never finished the rule writing. So we're in limbo now. I came in. They told me I had 14 days quarantine, but in my home. Well, okay. They said they were going to come by and visit me and do a second test, or not even test, check up on me, because we didn't have tests back then in March. Tests only came out recently.
Okay, so you, Jerry Perez, Ken, David, John, Mark Beldiga, that's it?
There was a few other people in the room, but we're all wearing these masks, so we can't tell.
Well, no introductions like hi and so and so.
No. With Carl Gutierrez, it's all business, man. You come in.
How often do you guys meet?
We met about 2 or 3 times.
Okay.
Carl is also, I believe, acting GVB, so he's got a lot of other things.
Right.
He just wants to hear our opinions. We spout off. He says, thank you very much, after he listens to a diverse range of opinions.
Right.
That's the smart thing about Carl. And then he goes off and makes some recommendations to the governor. Some are made, some are not. I mean, that's why I said is that, we have lots of ideas, but we don't know necessarily the final process.
Right.
There's a higher circle of authority that the governor has. Mm-hmm. I just simply saying is we need to do something. And it's upsetting me to see on this island 2 sets of people. Those that are receiving a regular paycheck and those who don't know when they're going to receive their next paycheck. Mm-hmm. And that's wrong. Yeah.
Well, Mike,
cause a lot of anger.
We're going to touch base with you again next week, and you tell us any developments with that tourism meeting. It's always good to get your definitely a different perspective on this show, so we appreciate your time this morning.
Thank you.
Okay, Mike.
All right,
I'll see you. Wash your hands.
Yes, of course.
Okay. 9:22. Good morning. We're getting Sergeant Paul Tapau coming up in just a couple minutes. We'll take